So I don't really know why the video is a little bit weird. Maybe it's the lighting. I don't know. Maybe that's it. But I had two appointments today. The second one was scheduled. The second one was my dietitian appointment, my first one. Today is February 2nd, 2022. And that one was scheduled. The first appointment, I got a call, I'd say around 9-ish, a little after 9, from Penobscot Respiratory. They are the place that will be doing my sleep apnea stuff. So I had a consult with them, and you have to have a consult first with them. I met with a doctor named Remy, and I honestly can't remember his last name, but he was really nice. And so we did a consult, and they're going to send me out a new patient packet and a questionnaire to fill out. But we talked about sleep habits and whether I snored, talked to my sleepwalk, sleep habits, what my medications were, different stuff like that, whether I wake up in the middle of the night, a whole bunch of stuff sleep related, and how restful I felt. If I've ever had a sleep apnea test done before. I've had a sleep apnea test done before, probably 2 or 3 times, before I had my, I'm trying to think, not weight loss surgery before, but when I was in the running for it maybe, and before and after my tonsils surgery before. So I had that done before. I did have sleep apnea. I did not continue with a CPAP machine. I did not like the company. I did not feel comfortable with the CPAP machine, but Remy did say if my sleep apnea was mild, the surgical weight loss did not recommend therapy, but if it was moderate to severe, they recommended therapy. And he said the biggest thing was communication with your provider, and that he was there. So that made me feel comfortable and that confident that I will, if I have sleep apnea still, that I will have somebody on board that will help me and make me feel comfortable with the thing that I'm using. So then my dietitian appointment went good. We talked about my weight history, my eating habits, my history with losing weight, what am I doing now for exercise and eating. I talked to her about changing my habits from back in October and having lost weight. I talked to her about my ups and downs and my weight and a whole bunch of different stuff, and also being pregnant and having gestational diabetes, and that currently being diabetic, I was not diagnosed with diabetes until the last 2 to 3 years, give or take, probably about 2 years, maybe 3, but 2 to 3. So that went really good. We talked about the nutrition that you will have basically before and after your surgery. Before your surgery and after is called the phase 2 liquid diet. So high protein liquid diet. So you're on a high protein liquid diet from 2 weeks before your surgery and 2 weeks after your surgery. And so yeah, that is that.